Welcome to our health series. Today, we're diving into a common yet often misunderstood condition: bladder stones. These hard masses can cause a variety of uncomfortable symptoms, and in this video we'll explore what they are, how they form, how they're diagnosed, and what can be done to treat and prevent them. Let's get started. Bladder stones, also known as cystolithiasis, usually develop when the bladder doesn't empty completely. This leads to concentrated urine, which allows minerals to crystallize and form stones. This incomplete emptying can result from various factors, including an enlarged prostate in men, nerve damage affecting bladder function, a neurogenic bladder, inflammation of the bladder due to urinary tract infections or radiation therapy, or even the presence of foreign bodies in the bladder, such as catheters. Now let's delve into the pathophysiology. It all starts with a nucleus. This nucleus can be a small crystal, a clump of bacteria, or even a piece of foreign material. As the bladder doesn't fully empty, urine remains concentrated, and dissolved minerals like calcium, phosphate, and magnesium start to precipitate and layer onto this nucleus. Over time, these layers accumulate, gradually increasing the size of the stone. The longer urine remains stagnant, the larger the stone can become. These stones then irritate the bladder lining, leading to inflammation and various symptoms. Bladder stones can affect anyone, but certain groups are more susceptible. Men, especially those over 50 with enlarged prostates, are at higher risk. Individuals with neurogenic bladders, due to spinal cord injuries or other neurological conditions, are also more prone. In children, bladder stones are less common but can occur due to metabolic disorders or structural abnormalities of the urinary tract. While precise global statistics are challenging to compile, the incidence of bladder stones generally increases with age and is influenced by factors like diet, hydration, and underlying medical conditions. So how do you know if you might have bladder stones? Common signs and symptoms include abdominal pain, often felt as lower abdominal or pelvic discomfort. Painful urination, also known as dysuria, is another frequent symptom. You might experience frequent urination, feeling an urgent need to go even when the bladder is not full. Blood in the urine or hematuria is a key sign that the bladder lining is being irritated. Some individuals may also experience difficulty urinating or a weak urine stream, and occasionally, bladder stones can lead to recurrent urinary tract infections. Diagnosing bladder stones typically involves a thorough medical history and physical examination. Your doctor may order a urinalysis to check for blood, infection, and crystals in the urine. Imaging tests are crucial for confirming the diagnosis. A CT scan of the abdomen and pelvis is often the most accurate way to visualize bladder stones. An X-ray of the abdomen can sometimes detect stones, but it's not as sensitive as a CT scan. Ultrasound is another non-invasive option, particularly useful for visualizing larger stones. Finally, a cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder and stones. While specific classifications aren't as commonly used as with kidney stones, bladder stones can be categorized based on their composition. The most common types include calcium oxalate stones, uric acid stones, struvite stones often associated with infection, and less frequently, cystin stones. Knowing the type of stone can help guide treatment and prevention strategies. Treatment for bladder stones depends on their size, number, and the presence of any symptoms. For small stones, drinking plenty of water may be sufficient to help them pass naturally. However, larger stones usually require intervention. Cystolithopaxy is a common procedure where a cystoscope is inserted into the bladder, and the stones are broken into smaller pieces using lasers, ultrasound, or mechanical devices. These fragments are then flushed out. Open surgery to remove the stones is rarely needed but may be necessary for very large or complex stones. Addressing the underlying cause, such as an enlarged prostate or neurogenic bladder, is also crucial for preventing recurrence. Medications may also be prescribed to help dissolve certain types of stones, like uric acid stones. Preventing bladder stones involves addressing the underlying risk factors. Drinking plenty of water throughout the day is essential to keep urine diluted. If you have an enlarged prostate, managing this condition with medication or surgery can help improve bladder emptying. Treating urinary tract infections promptly can also help prevent struvite stone formation. Dietary modifications may be recommended based on the type of stone you are prone to. For example, reducing sodium and animal protein can help prevent calcium oxalate and uric acid stones. The prognosis for individuals with bladder stones is generally good with appropriate treatment. Most stones can be successfully removed with minimal complications. However, recurrence is common if the underlying cause is not addressed. Recent research is focusing on less invasive techniques for stone removal and developing more effective medications to dissolve certain types of stones. Studies are also exploring the role of specific dietary interventions in preventing stone formation in high-risk individuals. Future advances may involve personalized approaches to stone prevention based on individual metabolic profiles. Thanks for watching, and we hope you found this information helpful.